Early signs that labor is beginning. Labor isn't a single moment, it's a series of phases the body goes through to safely move the baby from the uterus into the world. Today you'll learn every phase, every sign, and what actually happens inside the body during childbirth. These signs appear days or hours before labor starts. Each one happens for a reason: lower back pain and cramping. As the uterus tightens and softens the cervix, nerves around the lower back become irritated. This causes a deep ache, similar to menstrual cramps. 1. The bloody show. The mucus plug, which sealed the cervix during pregnancy, loosens as the cervix begins to thin. When it comes out, it may contain streaks of blood. This means cervical changes have begun. 1. Lightening. Baby dropping. Lower. The baby descends into the pelvis, reducing pressure high up, but increasing pressure low down. Breathing becomes easier, but pelvic heaviness increases. And 3. Regular contractions. True labor contractions gradually become stronger, longer, and closer together. These contractions begin the early work of softening the cervix. First stage of labor. This stage takes the longest and includes early labor, active labor, and transition. The goal of this entire stage: open the cervix from 0 to 10 cm. 1. Early labor, latent phase. Cervix is about 0 to 4 cm contractions, light, irregular. The cervix begins effacing, meaning it becomes thin and stretchy. The uterus starts gentle contractions to prepare for stronger labor. Baby starts to shift downward, applying pressure on the cervix. Some symptoms may include mild cramps, because the uterus is starting to warm up. Lower back pressure. Baby's weight shifts onto pelvic joints. Mucus plug loss. Cervix is opening slightly, causing plug release, talking through contractions. They're noticeable, but not overwhelming. This is the body's warm-up. Slow, steady cervical change begins here. 1. Active labor. Cervix is around 4 to 7 centimeters. Contractions get strong every 3 to 5 minutes. The uterus contracts rhythmically with much more power. Hormones like oxytocin rise, intensifying contractions. The cervix dilates faster and becomes fully softened. Baby moves deeper into the pelvis and starts rotating into birth position. Symptoms like intense cramping. Contractions squeeze harder to open the cervix. Shorter breaks. The uterus needs less rest between contractions. Water breaking. Pressure on the amniotic sac may cause it to rupture. This is when dilation speeds up and the body commits fully to labor. 1. Transition phase. Cervix dilates from around 8 to 10 centimeters. Contractions get very strong every 2 minutes. The cervix finishes dilating to the full 10 centimeter. The baby rotates into the final head down, face toward back position. Hormones surge sharply to prepare for pushing. Pelvic muscles stretch and soften rapidly. Some symptoms may include shaking or trembling, caused by hormonal flooding and intensity. Hot flashes or chills. Body temperature fluctuates from adrenaline. Nausea. Strong contractions strain abdominal muscles. Urge to push. Baby's head presses against the rectum and pelvic floor. This is the climax of labor intensity and prepares the body for pushing. Second stage of labor, pushing phase, from 10 centimeters until the baby is born. The cervix is fully open, allowing the baby to move through. Each contraction pushes the baby lower, rotating through the pelvis. Pelvic floor muscles stretch significantly to create space. The baby's head begins to crown at the vaginal opening. You might feel a strong urge to push. Baby's head triggers a reflex called the Ferguson reflex. Burning sensation, known as the ring of fire, caused by tissue stretching. Massive downward pressure. Baby compresses nerves in the pelvis. This is when the baby finally moves out of the uterus and into the world. Third stage of labor, placenta delivery, happens 5 to 30 minutes after the baby is born. The uterus continues contracting to detach the placenta safely. Blood vessels clamp down to prevent heavy bleeding. The placenta slides out through the birth canal. You could feel some mild cramps, similar to early labor but much weaker. Feeling of relief, pressure drops dramatically once placenta exits. Light bleeding, a normal part of postpartum recovery. This is very important because delivery isn't complete until the placenta is out, ensuring the uterus can heal properly.